All right. Well, as promised, last week we met with Sarah Green, the PA out in California, who treated either prophylactically or acutely thousands of COVID patients, guys, through 2020 and on. And we heard her story, and she also said that she would bring one of her patients on to talk. And so today is that day. This is the first time that I am having the discussion with them. I don't know, the turn of events that happened. So we're all going to find this out together. But what I really want to, just stress is that there are so many people, guys, millions of people that have been treated early and you don't know about it because mainstream media didn't report it. Instead, they came after nurses and doctors and said that they were going to remove their license. They were going to have to go in front of their boards and answer for what they have done. And a few doctors did get some notoriety because they were absolutely just dealt with completely inappropriately. And they did that to make examples out of them, right? So that the word would spread that this was what was happening if you had any dissenting voice, and if you were a critical thinker and wanted to engage in scientific discourse, this was how they were going to treat you. They did that to me with the Arizona State Board of Nursing. However, after answering 18 complaints, I was deemed ethical in my disclosure. And I know that Sarah is still going through a lot, and we'll touch on her story here in the beginning so you can be refreshed just in case you didn't listen to the episode last week. So let me welcome here today Sarah Green and Jodie and Mike. Thank you guys for being here. We're going to start with Sarah. Sarah, you want to remind people a little bit, tell about your story, what you went through, how you came to know the truth, and what you did about it. And then we can talk to your patient, Jodie, as well.
Perfect. And thank you for having me. Thank you for having us. I'm a physician assistant in California, probably one of the most strict states as far as this protocol goes for treating COVID patients. I actually had the opportunity and, quite frankly, the benefit of being treated with ivermectin when I came down with COVID in early 21. I knew about hydroxychloroquine, and I knew where I worked it would flag me if I wrote a prescription for hydroxychloroquine. So I kind of steered away, but knew that there was something I needed to do. So when I took ivermectin, and quite honestly, it was within hours, I felt better, was out of bed, like almost utilizing the time off as a vacation, obviously staying home. But
Right.
I knew that this needed to be something that I made available to my patients who were suffering. And instead of telling them that they have to wait until they're blue and can't breathe to go to the ER, there was stuff I could do, supplements I could ask them to take, and then prescriptions I could get them to help them get through this infection. And so when I was back at the urgent care, I started utilizing ivermectin for my patients who tested positive, and got called out by my supervising physician. I'd love to show a picture because it's kind of the epitome of what you would think as someone who would stop you from prescribing it, but I'll leave that out. And I was questioned why I was using it. I let them know that it was because I was not going to allow these patients to die, and I needed to treat them early on, and that they were doing great with the ivermectin treatment. And she told me it wasn't FDA approved. I corrected her and said it is an FDA approved medication, quite has been for decades, and has saved thousands of lives all around the globe. And she said, well, you won't be using it under my name. And I then questioned the vaccine that they were pushing and said, that's not FDA approved. And I walked out of the urgent care that day knowing I would never return. I left a stack of papers, journals, and research papers to show that ivermectin worked for COVID patients. But when I left, I actually thought I'd get out of medicine completely. It was just too corrupt for
Yeah.
me. I walked out of there and I said, oh, thank God I don't ever have to swab another COVID patient. I don't have to call another COVID patient and tell them they're positive. I don't have to give the bad news. I am so wiping my hands of COVID. And God said, no, you're not. Oh, no, you're not, Sarah. This is all you're going to do from here on out.
Oh, I know how that is. Trust me.
Yeah,
Trust
crazy.
me.
And that's what I did. And so I worked under a supervising physician for a short period of time that kind of let me do my thing. And I followed FLCCC quite closely. I followed the American Frontline Doctors closely. And I was able to help thousands of patients across the US because there was a law in place that allowed providers who were licensed in one particular state that could treat COVID patients across the US. So I did that. I had patients calling me from, Tennessee and New York and Florida. And I'd say, how'd you get my number? Mm-hmm. I don't even know who the reference was, but it was an honor to be able to help them and see with my own eyes the changes. I used Ivermectin, I used hydroxychloroquine, budesonide in a nebulizer, mm-hmm. Prednisone, vitamin C, D, zinc, quercetin, magnesium, NAC, and supplemental oxygen if needed, azithromycin or doxycycline. And we actually threw a couple different ones in there for Jodie, and I'll let her explain that. But it was something that God was pushing me to do. I needed to help these patients. And I took a Hippocratic oath when I became a PA, mm-hmm. and I wasn't going to allow the government to stomp on that. And so I used that oath and I did what I felt was right. And I kept thinking to myself, if Jesus were walking on this earth right now, what would he be doing? Mm-hmm. And he would be handing out Ivermectin to everybody. And mm-hmm. so that's what I tried to do. I tried to make it available to any and everybody that reached out to me. And I still do that. I still am treating COVID patients. I hope they don't really test, but I treat symptoms. And still patients can get COVID prep kits so that they're prepared for the next pandemic.
Yes, that's very important. Talk about the testing. Guys, the tests are experimental. There's such a high false positive rate. And like what Sarah just mentioned about, well, I hope you're not testing. I agree with that statement. There is no reason to test. Why test? Handle your symptoms. If you're sick and you have a fever and, you're really symptomatic, you shouldn't be around people anyway, no matter what you have. And right. Where we're at with, COVID and its progression, even after the vaccine escaped COVID variant, because that's what I believe. I believe that this would have just continued in nature the way that it was showing itself in 2019, right? Because we were taking care of a lot of people that were testing negative for flu, and we would diagnose them with viral illness or pneumonia or bronchitis. Those were, essentially the diagnoses that they were given, but they were also given treatment. We gave them prednisone for, steroid. We gave them albuterol inhalers or nebulizers. We gave them an antibiotic, to prevent a secondary infection if somebody's immune system was overwhelmed. We would do all those things. And then all of a sudden it just stopped. And we weren't doing anything like Sarah mentioned. And Sarah, I think it's also very important so anyway, once those tests came out, then it became all about COVID and the test. And then when the tests weren't good enough, right, they weren't increasing the numbers, even with the high false positive rate, we gave physicians the opportunity to say that they're presumed positive. So, all across the board, the numbers were completely heightened. But, still, again, people did get sick. I got sick. I got really sick in February, and I got on an antibiotic and steroids, and I was good, and I dosed the vitamin C. I was taking vitamin C every hour until bowel tolerance. That means when you're running to the bathroom. I was chucking in, 50,000 of vitamin Ds. I was doing the things anyway, because that is what we're taught. We are not all of us. I will say this, but those of us that kept up with the latest science, and we weren't listening. We were listening to functional medicine doctors or naturopathic doctors. That's how we gained, or chiropractors, really. That's how we gained a lot of the information that we had on supplements, because they were doing this for many, many years. And so, yes, I agree with you with the test. Even as an ER nurse now, they want to test everybody because they just want something. They want something to be able to say, oh, it's COVID. Oh, it's a flu. Oh, it's RSV. Even though our treatment options are going to be the same, we're going to treat the symptoms, right? And so at least now we're treating, somewhat, but yeah, so I'm good. I'm happy you brought up about the test, because if they come out with another test for another disease X and it comes out overnight, guys, I mean, I'm not rushing to get it. I never got it during COVID, not once. Well, one time when I was going to visit my grandbaby and my daughter who had just moved to Hawaii. There I did take a swab, but that was the first and only time that I ever did that. And I brought my own sterile swab to swab my nose with. So anyway, here we go. So yes, Sarah, I'm so thankful that you had the courage to step up and treat these people. How did you get in touch with Jodie? Or how did Jodie get in touch with you? Jodie, you want to answer that?
Well, it was my daughter. When I was in the hospital, we had tried to get a hold of a local doctor who would treat people and get, like Sarah, get people out of the hospital to treat them. But he was in Arizona. Okay. He's in your neck of the woods. And so I just said, well, we had no other choice really but to go to the hospital. And I'm thinking, well, I was going to try and get to a hospital that I was familiar with, had a good reputation. And so not go to our local hospital. And so we headed over to San Ynez and went there because my oxygen level was down to about 80. And I just didn't think I could get any worse. Yeah, I mean, I would get worse.
Yeah,
but
well,
I had Ivermectin,
okay.
But I wasn't, it turns out I wasn't taking enough.
Yeah. Yes. Okay, well, so it sounds like okay, let's go back a little bit further then. Okay. How did you come to find out about ivermectin and that there were doctors treating? I mean, do you watch CNN?
Oh, no.
Oh, okay. I didn't think so.
No, we knew all about Pierre Corey and Dr. McCullough, I think, was just coming on the scene. He was a little bit later than
the
Pierre.
Doctors that
Yeah,
in the forefront there.
Yeah, and Sherry Tenpenny and all these people that were out there and talking about it. And so we, said, well, we're going to go that route to try, because I knew if I got sick, I was going to get sick because my lungs aren't that great. And so both Mike and I were on ivermectin, and we had to get it through one of these online doctors until our pharmacy would no longer fill it.
Okay. So were you getting it through an online doctor in the States?
Yeah, it was, was it Push Health?
Push Health, they were one of them.
I think, yes. And so that's how we initially got our prescription.
Well, and then we got it from India, but it was intercepted by the government.
Yeah, we tried to get it from the all day
San Francisco.
So it was red. We were going for the ivermectin, the hydroxychloroquine, the antibiotics.
Yep.
So we were we just wanted everything on hand, but we never ended up getting that package.
Oh, okay. Mike, if you want to sit a little closer to the microphone, I'd love to include you in the
Oh, okay. Let me
conversation.
He's got a lot of pillows behind him to try and prop him. Up him.
let me try to get up there where I'm not gonna fall over.
Okay,
What is that?
good.
I don't know.
Okay, how we that?
So were you skeptical of the medical profession prior to 2020?
The way things were,
Oh, prior to
Mm.
2020,
Yeah.
I was a paramedic at one time.
Oh,
Actually, the military, a special forces paramedic. And then I ran at UCSB, their first rescue operation, brought them up to EMT status. And then I went to the police department as an officer. And then they became full paramedics in conjunction with the fire departments around there in their own rescue operation. And I would say that I am not happy with the medical community at all.
he was.
I was.
It was sometimes hard to be because he had toyed with getting the shot, and I was going, oh no,
right. So you were like probably most of us in
Yes.
2020 when this came out, we trusted that our medical community was going to, uphold the ethical principles.
Well, I'd hate to, lump the whole community in because everything comes down from the top. And there are plenty of individuals like yourselves that, could see that. And so many, chose to go away. Others chose to stick their heads in the sand, which is, human nature, or they just did not want to believe the information. They were doing what they're told, in their financial and family situations, but there's a whole lot of them to me that have a whole lot of guilt to atone for.
Yeah.
And
yeah, our house, no one got the shot.
Yeah.
And now the littlest one has not had any
injections. Yeah.
nothing.
You sound very similar to me. All my kids and myself, we had all our vaccines, the childhood immunization. And then when COVID came, it was my youngest was 11, and my two older ones are 32 and 29. And so they're out of the house. And then I have the grandbaby. Well, COVID happens and I'm like, oh my gosh, like I don't trust anything. And the more research I did, I realized that there wasn't research on the vaccines. So then I gave that information to my daughter, and I, was respectfully always suggesting like that she do research. And, I would tell her, if you were a baby, I wouldn't give you any shots anymore. So that you take that with what you will, but it sounds like none of my family got the injection. And, yeah. So, but first, thank you for your service, Mike. I really appreciate that. And I appreciate you willing to be involved in this conversation, because I think there are millions of us. I truly believe there are millions of us.
I pray you're right.
There are, but what we lack is courage, right? And that is, that, and I would say faith, right? Because if something inside of you is like, maybe I should pay attention to this, and you keep pushing that down. Some people call it instinct. I like to call it the Holy Spirit talking to us, because God created us and we are his children. So why would we think that he would, leave it up to our, evil nature essentially to, have these epiphanies every once in a while? That's how I think. I think it's the Holy Spirit talking to us. And I think if you look at everything that was pushed down on us to get us to comply, it was all fear. And fear is from Satan, not from God, right? Especially when it's fear of losing your job, fear of losing friends, fear of losing family, your paycheck, your status in the community. Hey, I get all that. I understand all that. But for me personally, it was something that I just knew was wrong. And even though I went a year and a half, essentially, standing up for my beliefs and my values while I was at the hospital, telling people masks don't work. And hey, do you want your loved one to come to bedside? Because I'll approve it. I worked hospital supervisor about 60% of the time. And if the nurse was okay with it, I would allow patients, family members in the hospital, and then just chart, family educated on a potential risk, exposure, and death. And they agreed, something like that. And so it's just really hard for me to look and say that it's okay because you chose your paycheck. I mean, I don't know. I don't think a lot of people know what they're made of, essentially. I think a lot of people are used to being comfortable, and they have done everything in their life to maintain that level of comfort, that when the idea that they may lose it, they just can't handle it. And as well, then that's where I think a lot of, Americans started talking like, oh, well, that's Joe's problem. That's his family's business. I'm not getting involved in his family's business. And I get that. I didn't for the longest time. I said, hey, this is what I think and feel and my research that I'm doing, but it's your decision. And it's still their decision. And I respect and love people where they're at. I'm not talking about it being judgment, but I don't know, Mike, I want to give you a chance to respond to that, because you've had a career in serving people in the community.
Well, people just get scared, and the first thing I learned as a cop is everybody's going to lie to you, even when they're right or wrong. They're going to put themselves in the best light. So, hospital situation. I mean, we've been in the hospital. Well, I've been in a couple times anyway since then. And as soon as we get in a room, hey, you don't need that. Boom, off comes the mask of the nurses, the doctors, and everything. They're just putting on a front because somebody's watching them.
Yeah.
Totally unnecessary. And I want to tell them to get a pair,
Okay.
something about your spine,
Yeah.
the stiffness spine,
Yeah. Grow a backbone.
Get all the information you can and find the truth, and don't let them beat you down. I mean, you've got big money. I mean, you've got big pharma. I mean, you've got the big food manufacturers, you've got the drug manufacturers, and you have the press, and they're all linked together, and they're taking marching orders from somewhere.
Mm-hmm. Yes.
And some of that's breaking down now. There's one guy who used to be on the news who is now taking ivermectin and wants to get back into it.
Cuomo?
There.
Yes,
Oh,
and not that we ever.
drop a name, but
Yeah.
We could drop names. This is an uncensored platform.
Yeah.
we could drop. Well, I can't say something about dropping him, but
Yeah.
and his brother, who deserves to be in prison at the very least.
Yep.
If not somewhere else, off the ground, 13 steps up.
Mm.
But a whole bunch of them like that
In a
that need to
nutshell.
go. In a nutshell.
Yeah.
Other than that, they have to honestly come to the truth. They have to come to their part, and there's got to be some atonement. There has to be the apologies. Otherwise, there's not going to be a single step forward anywhere.
Yeah. Agreed.
Not
Completely.
until that. I mean, people can be pretty forgiving. It'd be really hard in a lot of cases.
Mm-hmm.
Or say, okay, you live with it, just ostracize them.
Yeah.
That's it. You're there, you made your decisions, and you were told you refused to see the truth and the writings on the wall. So you deserve what you get.
Yeah.
I've got no remorse for them because they're still pushing it.
Right.
And
Right.
I
Right.
mean,
So
untold
Mike,
numbers
when
of deaths.
you said that we were similar and that we trusted the medical community. When did you guys realize that you were being fed propaganda and you looked at the conspiracy theorists, for example?
Well, if anybody, I do a lot of reading and stuff, trying to figure a lot of these things out. And on critical thinking, there's some very good things, programs, you find them on YouTube and other places, resource them out. And critical thinking is something that is just absent, and especially anywhere from the current universities on down, zero. And the powers that be count on that, because people cannot think and make a reasonable decision on anything. So, and then I look at all the power structures of how, they become tyrants and how people put up with it. And there's a whole series of things that you could research and find. But early on, I just looked at the standards and things where, things aren't matching up, things are not right. And then we started listening to Pierre Corey and what is it, the A, whatever,
Oh, the
FLCCC
Yes.
and all
Yeah,
this
all the
stuff.
doctors and the American.
And we had a cousin in the family who died early in the COVID thing. And she went to the 12 days and feeling really good, let her out of the hospital, that she's back in the next day, and died within 24 something hours. And they wouldn't give her any,
Well, I don't think
oxygen
people,
and all that,
yeah.
but oh yeah, you're getting better, you can go. But that day 12 to 14 in that thing before the spike proteins took over, and they delay the treatment, which is ridiculous.
Right.
Come back when it's hard to breathe. Well, why don't you knock it out day 1 or day 2 so you don't ever have to go back?
Yeah.
The protocols were just absurd, and they still are.
Yeah, you're right. They are. I love that you touched on critical thinking, because that's what I say all the time. I said, I refuse to fear, because I knew that once I went down that hole of like allowing myself to fear, and it wasn't just COVID, it was all of it, right? The mask, all of it, that I would lose my ability to critically think. And that's what propaganda is designed to do. It's designed for you not to critically think and to react on emotion. And when you are allowing yourself to consume all of this propaganda and tolerate it from others around you, right? That's a big one right there, guys, because you could choose to turn off the TV. You can choose to turn off that station. But when you have your family members saying you can't see your grandchild unless you get injected, or you can't go to school, or travel or anything like that, and you comply, I mean, that's where you lost your ability to really discern the truth from fear and to stand up for the truth. Here at AmericaOutloud.news, we are all about uncensored free speech and allowing people to have different voices. We have an officer that has a daily show. We have constitutional attorneys. We have 24/7 programming. You can get it on the America Out Loud Talk Radio app. You can listen to us on AmericaOutloud.news, on iHeartRadio. And then, of course, guys, all of the Nurses Out Loud shows go to podcast as well. And they're up there a day or two later. So make sure you check out our family of sponsors at AmericaOutloud.shop and keep us on the air. And we'll be right back. Thank you for joining me. I'm your host, Nurse Jodie O'Malley, and you are listening to Nurses Out Loud. I am here today with PA Sarah, physician assistant Sarah Green, and a couple of patients that she took care of, Jodie and Mike, who are joining us. On the first half of the show, I wanted to get a little bit of a background as to how they met each other and what their views were, because I'm hearing this for the first time, like you guys. And so let's spend this next half, and I'll let you start with this one, Sarah. How did you find, what state of illness was Jodie in when she connected with you?
Yeah, so I actually got a call from her daughter, and she let me know that her mother was currently in the hospital. They had transferred her from Santa Ynez Cottage Hospital to Santa Barbara Cottage Hospital, where they have a bigger facility, and I think that's where most COVID patients went. And she was pretty sick. She was on supplemental oxygen. I think at this point, you know, and she can tell you the horrors of being basically held captive in the hospital, but they were really pushing remdesivir. And thank God Jodie had done her research and knew 100% certain that that would kill her and that she would not take the remdesivir. She was taking ivermectin, and like she said, it just wasn't a high dose. It was a pretty small dose.
Mm-hmm.
So when her daughter kind of gave me the information, how long she'd been sick, and that they were pushing her remdesivir, and that they were actually, Jodie, I'll let you say what it is, but you know, doctors were refusing to give her blood pressure medication because she was refusing to take the remdesivir. So when I learned all this, and I had pulled a few patients already out of the hospital, I said, okay, here's what we're going to do. I want you to call the hospital right now and let them know that you're getting your mom out against medical advice. So the hospital is prepared and know that you're coming. So you're not sitting there. It's about an hour from their house or so. So you're not sitting there waiting and waiting. I called my oxygen supply company that I had used across the nation and asked them to deliver a tank at the hospital in the ER so that we could transport her with oxygen in the car, and then got an oxygen concentrator at her house. We got her all her meds set up, got the budesonide, the prednisone, the ivermectin, the antibiotic, and we were able to get her home and then care for her at home. And she, you know, it was a touch and go for sure, but I knew that she would not make it in the hospital. That was a guarantee. And so here she is. And, you know, she now has she's got 3 beautiful grandchildren, but the youngest, she just told me, just turned 2. And so, you know, it's such a blessing. And it, you know, it gives me chills because the hospital, the people that you trust, the doctors that you put your faith into, the establishment that's supposed to do no harm was out there on purpose murdering people for their pocketbooks. And so, you know, it's they will, you know, if they don't face charges here on this earth, they will face their maker, and they will have to be accountable for what they did. And thank God Jodie was not one of their victims.
Yes, absolutely. So Jodie, when did you start experiencing the illness? At what day did you go into the hospital being symptomatic? How many days were you sick?
I believe we started getting symptoms around it was before the new year in 21.
Yeah.
And then on the 11th, I think I went into the hospital, and I think that's right. I
Yeah,
went in.
she always tries to tough everything out and beat it just by sheer will. You
Yeah.
know?
Were you encouraging her to go to the hospital?
Yes.
Yes. Yeah.
And
What
even
was she like? Like, what was she coughing? Was she short of breath?
Oh, yeah. Yeah. And at night, I mean, up and down, cough all night, you know, and everybody's losing sleep or not able to sleep. I mean, I cough too, but nothing like hers, which, I mean, she's had, some lung issues before. And, you know, I don't, that and mostly the coughing is just fatiguing and really lethargic and weak.
Yes. Yes.
You know?
So you go to the hospital. Tell me what happened. Mike, were you able to go with her?
Well, we got to the parking lot together, and that's where we got separated.
And I kept saying, I didn't even get to kiss him goodbye. I
Mhm.
didn't get to kiss, because then I was gone. They walked me walked me in, and he was told that they were going to get a wheelchair for me because my oxygen, but I know they walked me all through the halls and watching my finger with a meter on it, and and then it was just a long time before I got to talk to him at all, because well, they sent me in for so many tests, but people didn't want to come in to see me. They just fling a thing on wheels in to try and communicate through an iPad or something, and it it was just so surreal. I'm going, where am I?
Okay, so you're saying that the doctors and nurses and the other staff like were not wanting to come in the room, that whenever they got a chance, they
it was
put in a
mainly
video?
the doctors, I think,
Mainly,
that
yes.
that they would shove that thing in the room. The nurses would
Mhm.
get me all set up, but the thing was they didn't give me oxygen, which I really felt I needed. And not until just before the ambulance came, and that was hours.
It was dark, basically.
And they had taken me for the CAT scans and the EKGs, the
Wait,
X-rays.
you're saying that you had an ambulance come and pick you up at the hospital
Yes,
and to take you off site
to
for?
transport me down to Santa Barbara.
But it's about 50-mile trip.
Oh, I hear you. So when you first get into this community hospital,
Well,
they
it's a branch of the same.
Yeah,
okay, they just don't have like higher level of care. Is that
right.
it?
Right.
They didn't have a
Right.
COVID unit.
Okay, gotcha. So in your first experience, you were in a room, but they needed to, you were in the ER?
I believe that's where it was.
Mhm.
Yes,
Yes.
section of the ER.
I want to make a note real quick too, Jody. This is a hospital, a high-end hospital, but small. And the quality of care, physicians were too scared
Mhm.
to actually enter this room to evaluate Jodie, to listen to her lungs, to hear her story. If you're that scared,
Mhm.
get the hell out of medicine. That you
Yes.
don't belong there. And so they treated her like she was a number. They pushed in a cart to communicate with her. They refused to give her supplemental oxygen when her oxygen saturation was 80% or lower when she got in there. They did not give her a wheelchair to get her into the hospital. So they're making her exert herself. And this is hours. And this is just one story. This is hours that she was at this small hospital with no oxygen and not a single physician putting hands on her and listening to her before they transported her down. She was a dollar sign.
Mhm.
She was money in the bank for this hospital to make after they tested her positive, gave her the remdesivir, intubated her, and murdered her. And those are the check boxes that are needed to make the most money possible to have a COVID death on that certificate. And she was a dollar sign. I couldn't imagine if a patient came to me,
Yeah.
I don't care what you have, and said, I can't breathe. I'm saying, get the hell in my office now and let me examine you. This is, you don't belong in medicine. You don't deserve to have that license. Get out of it. This is not a place for you. And that, I just wanted to put that 2 cents in, because this poor woman suffered for hours without getting the proper care before they transported her and had her off their hands.
And
Yeah.
I might say that the doctor the next day, not the Dr. Death in the middle of the night who
Yes.
came in, but the next day I brought it up to the doctor, who was much nicer. And I said, you're making money off this. The hospitals are making, because we did research, and you're making money off all this stuff, big bucks. And he goes, we make money off everything,
Mhm.
even Tylenol. I went, okay, where I want to be.
Well,
But-
people would be shocked if they followed the money and looked at their protocol for what treatments they got paid for and how much. It's like a government contract where you pay $700 for a freaking hammer.
Right.
This is what they're getting paid for. And if they can get you in, and if you pass away, they clear out the room and bring in the next one. Production line.
And I did not have I had not had a test up until that time where they did, but it wasn't the to your brain one. Because I said, I won't take that if you're going to stick it up into my brain. And
I had that
they
once
said,
and never again.
I know he did too. That same place. Anyway, for a test you had to have done or something.
Yeah, so then you're transferred to the other hospital.
Right.
And did the doctor come in the room and see you then?
I didn't see a doctor there until the middle of the night. When he made his appearance.
Slid in the
No, he
door at the side of the wall,
he kind of
the far wall.
I was awakened in the middle. I had just gotten to sleep, and my bed shaking and shaking. And I believed he was kicking from afar, kicking the bed to wake me up, because he was standing in the dark around behind the kind of the door. The door was closed, but he was standing in the shadows behind the door, as far away from me as he could get.
Wow.
And
How many hours were you in that hospital before he came in the room?
oh, let's see. It was dark when I got to the hospital, so I don't know, maybe
Midnight or
it was
or-
no, it was after midnight. It was
1
one
or
or
2?
two at night.
You
Or-
got to the
I
hospital?
mean, in the morning.
You got
No,
to the hospital?
AM, 1 or 2 AM
I want to say what time that maybe 7 or 8. I might have gotten to the
hospital.
the hospital there and went through. And the thing is, I'm looking at these people that I know that they're going in the same direction. You know, I am, and I've just got so much empathy for these people, and
Yeah.
they just going through. And I was so determined I was going to make it. You know, I was just so determined.
Yes. And it's hard. How long were you in the hospital before you met Sarah?
I didn't meet Sarah in the hospital, but
Right.
Paige, my daughter, had set it all up. Thank God, say Sarah.
Set up the
He
jailbreak.
goes like, we found somebody. She's gonna get you oxygen. I said, I need to get out of here. I think
Right.
they're gonna kill me here, because that doctor came in screaming in the middle of the night saying, you want to die? You want to die? If you don't take remdesivir, you're gonna die. And I'm going,
Already knew otherwise.
you know, wait, I'm not even awake. Oh,
Wow.
and
Yes,
I
we
told
heard that.
everyone.
We heard that a lot. We heard, well, if you're not vaccinated, that means that you must want to die. So we're not going to care as well as we normally would have. Doctors at our hospital, same thing. Many of them didn't go in the room. They would just chart, and the patient's chart, report received from nurse due to limiting COVID exposure. And I would just think to myself, like, wow, like you just don't go and see any patients. And you're just taking, I mean, our word. Hopefully the nurse had good assessment skills, but when people were diagnosed with COVID, that was it. It essentially was it. You maybe would hang some fluids on them, maybe, right, in their IV, because a lot of the time they had oxygen on. So did you have a mask on, or did you have just the prongs in your nose?
The prongs in my nose.
Okay. And how many days were you there before you left?
I was out of there the next day.
Okay.
I was
Less than 24 hours.
because I couldn't stand another day. I told I can't remember the doctor that came in during the day. I said, I'm getting out.
You
I'm
did.
getting out. And he goes, it'll be against doctor's orders. And I said, I'm getting out.
Mhm.
And I told the nurse too. She goes, well, we haven't heard anything. I said, no, I'm getting out. They found Sarah
They're
and
coming to save me.
yes. And I all night, it's hard after having that doctor come in like that. And I knew I couldn't call them because they're probably getting the first really good night's sleep in weeks because I was not there. And so I waited till morning to said, first thing, they're gonna kill me.
Yeah. Sarah, was it hard to get her out? Because I have heard dozens and dozens of stories of police being called, the refusal of transfer, all of that. Was it easy for you?
It was never easy to get them out. I think that once Jodie might have been one of the first ones that I pulled out of Cottage Hospital. Once they got my name and I pulled several out, it became more difficult to get them. They held these patients as prisoners. Thank God again that Jodie knew she didn't want remdesivir. She knew that the doctors were trying to kill her. And so she didn't fall into them saying, lying to her. I did have some patients, and we still got them out, where the doctors would tell the patient, your wife is trying to kill you, your spouse, you're going to die on your way home. So I think that this was probably one of the first ones that Cottage had seen me pull out of. And so it wasn't as difficult as long as they know in advance, because I just don't want families waiting for hours and hours to get them out, because who knows what they're doing to that poor patient who has no voice, who's weak and can't breathe. And I found a lot of my patients, they would dehydrate them and malnourish them on top of everything else. So you're already going in there. Jodie was already sick for 11, 12 days when she was admitted. I'm sure that her body was depleted in just about every nutrient possible. So the fight became weaker on her end, I'm sure. But it wasn't, I do have some patients where, it was, the police were the next call to get them out. We didn't have to go that far, thank God. But I think that Jodie was a little bit easier, and she wasn't falling for the lies that the physicians were feeding her. So I think that they realized that she was not one that they could convince to stay, where they tried to convince many of my other patients.
They weren't going to make that much money off of me.
Yeah.
Yeah.
Yeah. Sarah, you've mentioned several times now, and I want to give you an opportunity to explain what you mean, because some people hearing this might think, oh my gosh, that's so extreme. No, nobody is trying to murder anybody in the hospital. That's so right-wing, extreme conspiracy theorists right there. Explain to people what you mean by that, and I'll give you the floor here.
Sure. Well, there was financial incentive. So you needed those check boxes to get the most money. I have patients who lost family members from, let's say, cancer in the hospital. And on their death certificate, it listed COVID. They didn't have COVID. There was no signs of COVID. They weren't tested. People that were getting tested post-mortem, dying from car accidents and dying from gunshot wounds. What was the purpose of listing COVID as the cause of death if there wasn't a financial incentive? So we had the government funding these hospitals, and that's why these hospitals followed the government protocols. Because if a hospital said no, and Dr. Paul Merritt can attest to this because his license was pulled when he worked at a university hospital for giving vitamin C and hydroxychloroquine and dexamethasone and not following the protocol, the hospitals would lose their money coming from the government. And that was where their funding was. So our taxpayer dollars were going to the NIAID, NIH, all of these government funded agencies to pay these hospitals to follow the marching orders. And those marching orders almost always would lead to death. And so there is 100% financial incentive. And it's very easy if you do your research to find that. I don't know why we weren't incentivizing hospitals to treat COVID patients, get them better, and send them on their way and have them do great. Why were we not paying hospitals to help rehabilitate these COVID patients and get them home?
Right. Clinics could have been set up all around to do that, right?
Absolutely.
They did that in, I believe it was Brazil, where they handed out COVID packages to their population. And
India did it too.
And Japan.
And India did it.
Yes.
And so, Yeah, I get it. And I say this too. Why are there no hospitals that want to be as centers of excellence for COVID treatment? There's no hospitals that have stepped up. There's no universities that have stepped up against this narrative. And furthermore, there was only one drug that was pushed, and that's remdesivir. And that drug came with a 20% bonus payout of the total hospital admission stay. It wasn't just a 20% bonus on remdesivir. It was for their entire hospital stay. I mean, it is wild and it's maddening. And I understand. So where are you, do you think, or why, okay, let me ask you, do you think that physicians and nurses were murdering people that they, what's the word I'm looking for? Complicit in murder. Were they complicit or was it premeditated?
I think it was complicit, although it doesn't take long to see the outcome of their patients. You know, as soon as you give that remdesivir, it doesn't take rocket science to realize, oh my gosh, they were actually doing okay. We just gave remdesivir, and now they're like, now we've got to intubate. Now their kidneys have shut down. I mean, you do that over and over and over again, and it's common sense to know that there's something we're doing now to drive to expedite their illness. And I mean, I got on the phone with I had a patient in the hospital. Unfortunately, she could succumb to the protocol. And I spoke to one of the nurses and I said, don't you guys do huddles? I've worked in a hospital setting for most of my career. I know that we do huddles. Don't you guys do huddles in the morning and say, what's going on? We're getting these patients, you know, they're requiring 2-3 liters of oxygen. Mm-hmm. We give them remdesivir and they're tanking. What? Yeah. I mean, it just 1 + 1 is 2. And so they're maybe at first they're taking marching orders. However, I don't think that is going to get you off of being complicit in this. But after you realize over and over that there's actually something you're pushing to drive that, then I don't see why else that can't be premeditated. They know when they go to work, and you know what, it needed to take doctors, PAs, nurses, MAs to stand up and say, enough is enough. I will not push that drug. But they didn't. Yeah. And I know a lawsuit right now going on for a patient who, not my patient, but she basically was murdered by the all the drugs, not remdesivir, but Presidex and morphine and midazolam. And you know, you get all these drugs on board of a patient who is actually breathing on their own. Maybe their oxygen's low, but I was surprised I could see patients with an oxygen saturation of 80 and they were okay. They were holding their own. Yeah. But you throw a bunch of respiratory suppressive drugs on board, and they're not going to maintain that respiratory drive. And so it was a setup. It's all a setup. And it's so crazy for us to look back and people say, oh, it's over, get over it. No, you don't. From this.
Yes. It's just starting.
Yeah, it's just starting. And
I'm
just glad that I am unvaxxed and our blood's going to be worth a lot.
Yeah, there you go.
Very near future.
Yeah, but we have to be careful because everybody's going to want our blood.
Right. Well, now they're putting the vaccine in our food supply, in our produce, and our meat, and so
and make our own bread.
you really have to be extremely cautious of where you actually get your food supply now, and that's how crazy the world has become. But no, I think from the medical assistant all the way up to the pharmacist who's now releasing that drug for the nurses to push, every single one of those in that step are responsible for the death of each patient that died in that hospital. 100%. Yeah.
Well, you know, you sit there and you think about it, and it's like we can say all the things that we want with how COVID came on the scene and the suppression, and oh, we didn't know what we know now. We didn't know it then, but we know now. Just give it time. It's a novel virus. It's this and that and everything in between. Maybe that's all true. But what we do know is that all of these professions, pharmacists, nurse, doctors, we all have ethical obligations. Guys, for nurses, it's outlined in the 7 principles of nursing ethics, the 9 provision with interpretive statements. I'm doing a course on this because even as I'm preparing for this course to get it out to people, so nurses can remind themselves and patients can even take the course. People can take the course so that they know what they should be expecting of their nurse, right? As I'm doing this, I'm thinking, oh my gosh, it's literally in black and white multiple times that ethics are not to be compromised in any situation. And that includes a pandemic or a plandemic. Guys, thank you so much for joining me today. I appreciate you telling the story. I'm happy that I'm here, that I can hear it, that you're here to tell it. And Sarah, again, thank you for your courage and your fight. And I know you still have a fight on your own. So please, guys, check out Nurse Sarah. I will have all of her information in the show notes so you can reach out to her as well. Then until next time, be safe, be well, and God bless.